We've all heard stories about challenges consumers face when shopping for insurance coverage in the healthcare exchanges. To discover what consumers are experiencing firsthand, we went on the healthcare exchange and searched for basic information about health plans. The Partnership to Fight Chronic Disease, a coalition representing more than 100 different healthcare stakeholders, is focused on raising awareness of the human and economic toll of chronic disease and advocating for health reforms that lessen that burden. For all consumers, but particularly for people with chronic diseases, having good healthcare coverage is critically important. There are many questions consumers want to answer. Two basic ones are, can I keep my doctors, and are my medicines covered? To see what a consumer has to do to find out if her doctors are covered by a specific plan, we searched for health plans available in Nebraska. We used healthcare.gov for our search because Nebraska uses the Federal Healthcare Exchange. We narrowed the search to Lincoln, zip code 68508, and identified as a 52-year-old non-smoker making $51,000 a year. 20 health plans are available in that zip code from 3 different insurers. We narrowed that down to just silver plans since those have been the most popular with consumers. There are 6 silver plans available. We took a look at the lowest premium silver plan from different insurers to find information about doctors. It was great to see links under each plan for a provider directory, making it easy to start the search for doctors covered. For the first insurer and the least expensive premium silver plan, the provider link sent us to this page with a list of 6 different options from which a consumer has to choose the right product or network. Our health plan had both Coventry Healthcare of Nebraska and St. Elizabeth Regional Medical in its name, so we weren't sure which one to choose. The fact that the choices were there indicated that making the correct choice is important. So we went back to the exchange to look for more information to help us make that choice. We checked the Summary of Benefits document and found a new web address that led to information about covered providers. We cut and pasted the link to that web address to go to the website. It's the insurer's homepage. There is a link at the top of the page to find a doctor, so we tried that. We had to scroll down to find a public search option since the other search was only for members of the health plan. The link connected us to a page with a list of different choices for product or network. This time there were 14 different choices. St. Elizabeth Regional was again a choice, but Coventry Healthcare of Nebraska was not. We tried St. Elizabeth. That link led us to a search engine. We entered our zip code, 68508, and could search by condition. We tried cancer and got 2 results within 20 miles of that zip code. We tried oncologist and got none. We tried oncology and got 6 results. The search terms used are very specific and can make it difficult for consumers to get to the information they need. We went back to our original search and tried to find doctors covered under the least expensive silver plan from another insurer. Again, we started our search with the provider directory link. The link sent us to an external website with 2 lists of medical providers, each with a separate search engine. We tried the Aetna provider list by selecting Find a Provider. We selected specialists and then could use a drop-down menu to find types of specialists in network. We tried oncology within 20 miles of our zip code and got 5 providers, each with 2 different locations. We then tried hematology oncology and got 2 different providers. These searches are also very specific in terms of provider types, so consumers need to know for which specific type of provider they are searching. The link to find a provider directory under each health plan on the exchange is helpful to consumers. Following those links to locate the correct network of providers and knowing the right terms to use with the search tools present challenges to consumers trying to discover which plans cover their doctors.